Today we're going to focus on tracheostomy care. This is typically done for a patient who has a tracheostomy in order to make sure that that airway stays patent, to make sure that any kind of secretions are cleaned out of the inner cannula. So like with any other skill, we're going to first of all confirm our order. Typically a patient who has a tracheostomy has tracheostomy care ordered typically on a routine basis, every shift, every 8 hours, something of that type, because again we're dealing with the airway. So make sure that we have our order. The next thing that we want to do is make sure that we have all of our supplies before we enter into the room. So the supplies that we need for tracheostomy care are hydrogen peroxide, which is going to be our cleaning solution, normal saline, which is our rinsing solution. We're going to need a towel, stethoscope, our tracheostomy care kit, and again these are going to be different according to what facility that you're going to be at. So for this instance I'll demonstrate with this type, but you may see different types when you go to different facilities. We're also going to need a pair of clean gloves. Then we're going to need our personal protective equipment, which is going to consist of a mask with a face shield, or you can use the plain mask and then a pair of goggles. You're also going to need your gown, and then you're also going to need a biohazard or a red bag. So I've gotten all my equipment. I'm now going to come into my patient's room. I'm going to identify the patient, explain the procedure, introduce myself. So good morning, I'm Ms. Shoemake. I'm going to be performing tracheostomy care. We're checking their name against a Cardex or some other kind of treatment record. We also going to assess for any type of teaching that may be needed. If this is the very first time that she has had tracheostomy care performed, then we may need to do a little bit more teaching with that. So we've got all of our introductions done. We're going to make sure that our door is closed, our privacy curtain is pulled. Before we get into the skill, just like with anything else, we're going to go wash our hands. Next thing that we're going to do is we're going to go ahead and raise our bed. For demonstration purposes, I'm going to leave the other rail down, but normally we would take that up. However, when we're demoing, it's hard to see with the camera. So I'm going to put the side rails up. I'm going to raise the bed for good body mechanics. Once I get the bed up, I'm going to lower the side that I'm working on. Next thing I'm going to do is I'm going to do an assessment on the respiratory system for my patient. So some things that I'm going to assess is going to be the O2 saturation, respiratory rate, and then lung sounds. So I've checked respiratory rate, O2 saturation, I'm going to check lung sounds. Remember that when you're checking lung sounds, you listen underneath clothing, never on top of it. You're going to listen to all lung fields, anterior, posterior, and lateral. You are going right to left or left to right, and you're comparing each side as you are going right to left and then moving down and across. And we do that with all the different lung fields. This data will serve as our baseline. We will recheck all of this information after the skill's been performed, again to make sure that nothing has changed with our patient status. So we've done all of our assessment. The next thing that we're going to do is we're going to go ahead and put on our non-sterile gloves. Also, I'm going to go ahead and place my biohazard bag or red bag into the garbage can. Also with this skill, one of the key components is making sure that you have your table and your garbage can within reach. This is going to be similar to setting up sterile technique, sterile field, and so we want to have everything within our sight when we are performing this skill. Alright, so the next thing that I'm going to do is I'm going to take off the old dressing. A lot of times it already has mucus on it, so that's why it's really important to go ahead and put on your gloves. I'm going to go ahead and take that off. Note any type of drainage that is on there for my documentation after I get done with the skill. So go ahead and throw that in the red bag. Next I'm going to assess my tracheostomy site. I'm looking for any redness, any swelling, any type of drainage. So I'm just looking at that site, making sure there's nothing wrong with it. So it looks good. Next thing that I'm going to do is I'm going to go ahead and take off my gloves, put up my rail, and go wash my hands. Next thing I'm going to do is go ahead and get my equipment assembled on my table, kind of in the manner that I want to use it. I'm going to go ahead and put my patient up in a semi-Fowler's position. Then I'm going to place the towel over her clothing, and this is for a couple of purposes. Number one, it's to protect her clothing from any secretions that could come out when we take that inner cannula out. Plus, it also will help protect her skin if any secretions drop on her skin as well when we take that inner cannula out. Alright, so the next thing that we're going to do is, if you look at your skill manual, it talks about promoting patient involvement. So this is letting the patient be involved in his or her care. You may need to have them identify a signal if they get into any kind of distress, raise their hand, blink their eyes, something that they are able to do. Also, you're assessing their tolerance. Is this the right time to be doing trach care? If they're in a lot of pain or something else is going on, we may need to wait to a later time. We're also going to give them paper and pencil, so if they need to write down something. After that, we're going to go ahead and put on our PPE. So we're going to go ahead and put on our gown. We would go ahead and put on our mask, face shield, goggles. Because it obstructs my voice, I'm going to keep the shield off, but this would be the time that you would go ahead and put that on. Alright, so I've got my PPE on. So the next thing that I'm going to do, so I'm going to set this to the side since I'm not going to be fully having that on. Okay? So the next thing that I'm going to do is I'm going to go ahead and loosen the caps of my solutions. The reason being is here in just a few seconds I'm going to become sterile. We're going to keep the dominant hand sterile, and the non-dominant hand can be non-sterile. So it will be the one who is grasping the solutions to pour them into the tray. So because I'm only going to be one-handed, I want to make sure that these caps can be taken off with one hand. Okay? So I'm just going to loosen them a little bit, keep it on. Remember that when you're dealing with sterile fluids, that the longer they're exposed, they become contaminated. Okay. So the next thing that I'm going to do is I'm going to go ahead and take the top off of my tracheostomy tray, and remember, when we're opening packages, we go away from us. Okay. So this is the interior of my tray. So the next thing that I'm going to do is going to go ahead and grab my gloves without touching anything else. Remember, when you're dealing with sterile field, your feet are not set in concrete. You can move. Use the table. So I'm going to go ahead and open. One of the things I like to do before I become sterile is I just kind of pause for a second and I think about, is everything prepared so that I can become sterile? Is everything ready where I can reach it, where I don't have to contaminate my sterile field? So I'm going to open my gloves on. Open my gloves up. We're going to glove our dominant hand first. And remember, with sterile gloving, we pick up the first one by the cuff, the part that's folded inside. Kind of hold our hand up away from our table, gently pulling on that glove. Pulling the cuff down just a little bit. The next thing for my second glove is I'm going to grab inside of the cuff, pull it up. As I'm pulling on this glove, my dominant hand, the thumb, I kind of pull back away from it so that I don't get it contaminated. Okay, pull that glove on. If you miss a finger, which is likely to happen, then you can go ahead and fix that at this time, because I'm sterile, my glove is sterile. Don't worry too much about getting the cuff unfolded, because sometimes when you try to do that, you contaminate one of your gloves. So this is fine just like this. We're going to take our paper and just kind of pull it into the garbage can or on the floor. One of the things that I typically do is when I have my hands that are sterile, I will hold them together until I need to do something with them. Okay? So the next thing that I'm going to do is I'm going to set up my sterile field. So I'm going to grab my drape, and I'm still sterile. Both hands are still sterile at this time. Pick up my drape, and again, I generally take a step back, hold it up, very carefully let it fall, fold out. Remember that the shiny side is what's going against the table, okay? So we just let it, and we let it drop, okay? Be careful not to place it on the table, because then you can contaminate. Once we get it on the table, then we can take our hands and just move it to where we need to be. Remember that when you're dealing with a sterile field, that 1 inch of that border is considered to be non-sterile. So the next thing that we need to do is we need to get all of the supplies that are in our tray out on our sterile field. So remember, we don't cross over anything that is sterile with a non-sterile part. So the only part of my hand is my gloved hand. So I can come in from the side, pick it up, bring it out, go ahead and set it down. You can separate. You have some split gauze in here. You have your tie. So then I'm going to come around and get the cotton tipped applicators and the brush out. So now I have everything on my sterile field. So now what I need to do is I need to pour my solutions into my tray. So again, remember, we're going to keep the dominant hand sterile. So what I typically do is I take it and I ball it into a fist. And that lets me know that it's going to remain sterile. So then I'm going to go over, and again, you can do this in multiple ways. If you could get through here without going over your sterile field, you can grab your solutions. Or you can just come over here. We'll take off the cap. Grasp it by the label. Bring it over. I'm going to lip it. Remembering that lipping is what clears the lip of the bottle. I'm going to pour one of the trays with the cleaning solution with the peroxide. Bring it back over. Put the top back on it. Take my saline. Again, holding on to the label in my palm, coming over. And again, this whole time, the sterile field's within my view. Lip it, come over, and I'm going to pour 2 of the trays with the saline. Remember, when you're placing the tops or the caps of the solutions, remember you place them with the bottom down. Alright, so now I have all of my solutions poured, my equipment ready. Now I'm ready to go ahead and take out the inner cannula from the tracheostomy. So what I'm going to do, again with my non-sterile, non-dominant hand, is I'm going to take the inner cannula. With this type that we have here, what you have to do is you have to pinch together the tabs and then pull. So what I do is, because I'm doing this one-handed, I take 2 fingers, and with the other finger I push down on the plate so that it doesn't pull. And we may have to re-demo that when you get to practice time, but that's okay. I just wanted you to get the gist of it. So now I have the inner cannula in my hand. So the first thing that I'm going to do is I'm going to place it in the cleaning solution, which is going to be the peroxide. So we just take it, dip it in, gently rock it back and forth. so that that solution can move through that inner cannula. Kind of make sure that the outside part, with my sterile hand, I'm going to grasp my brush. Take a step back, make sure that I'm not right over my sterile field when I'm cleaning. I'm going to take the brush and go inside the inner cannula, scrubbing it. Then I'm going to go to the outside. Now I'm done with it, so I'm going to drop it into the garbage can. Next thing that I'm going to do is I'm going to put it into the rinsing solution, which is going to be the normal saline. So it's going to be the same process, getting some in there, rocking it back and forth, getting it through the cannula, making sure that it's clean. So I've got it washed, rinsed. So now what I'm going to do is I'm going to tap and get as much of that liquid out of the inside. Now I'm going to take some gauze and I'm going to clean the outside or dry it off. And you always start with the cleanest part to go up to the dirty. So the cleanest part is going to be the lower end, the part that's going to go further into the patient. So I'm going to start there, drying, moving it up to the dirty end. Once I get that done, throw that gauze away. Then I'm going to go back and I'm going to reinsert the cannula in. When you typically insert it, you kind of want to go at an angle, and again, we may have to demo this a little bit more in lab practice. Angle it and then go straight in. Some of the cannulas could be a little bit different than the one we showed you today. Some patients who've had it for several years, theirs may even be metal. Okay, so you may just be prepared. Sometimes with the metal ones, they're a little bit longer. It seems like it takes forever to get them out. Now, once we've got that cannula back in, the sterile aspect of our skill is pretty much done. So the next thing that we want to do is we want to take our cotton tipped applicators and we're going to dip it into the third section of the normal saline. Then we're going to just clean around the stoma, getting rid of any dried mucus. Okay, if I needed another one, throw that one away. Grab it back into our solution, cleaning that. So now that area is damp. So now what I'm going to do is I'm going to take some gauze and I'm going to dry that area. When you are doing any type of work around the tracheostomy site, you want to stay away from anything that has lint. For example, cotton balls have a lot of lint, so you'd want to stay away from that. So typically the gauze that's included in your kit is what is good. And again, we're just dabbing that skin, drying that off. Anytime we wash, rinse, we have to make sure that we dry it so we don't get any skin breakdown. Okay, so that area is dry. The next thing that we're going to do is now we're going to change the cotton tabs that are holding the face plate against the patient's skin. So, it's a rather long piece of cotton twill. So, typically what you don't do is don't completely untie it and then put the new one on. Because what can happen is if you completely untie it is that face plate and even the tracheostomy, the outer cannula, can come out of the patient. So what we typically do is go ahead and get one side started. And again, this may be difficult to see on the video, so we may have to do some more demonstration. So I'll put one side through. Then if you want to, we've got one side through here. We can go ahead and untie the other side over here. Then what we're going to do is the new one that we put on, we're going to bring it around the patient's neck, making sure that it's straight. Try to pull it a little taut when you're putting it around so that you can straighten it out. Okay. So now I'm going to put one side into the plate. And then secure it with the other side. Once I get it secured, then I'm going to go ahead and take off the old one. Okay, so go ahead and take that one off, just slide it through because we already have that one secured. Okay. Once we get the tab on, then you can place your split gauze underneath. You could have even done this before you did the cotton tab. It's up to you which one you want to do first. So we're going to slide this through there. Again, just making sure there's as few wrinkles. Again, making sure it's protecting her skin. At this time, I'm going to take off my gloves, put up my rail, wash my hands, and then I'm going to reassess my patient. I'm going to again listen to lung sounds, check respiratory rate, O2 saturation. Once I've done that, then I want to make sure that I provide oral care for my patient. So I would do that with toothbrush, toothpaste, or toothettes, whatever the patient uses. The next thing that I'm going to do is go ahead and take off my PPE. After that, I'm going to clean up all my supplies, throw everything away, put my saline and peroxide in a place where I can use them later. So I throw all this away, go ahead and take off my towel. I'm going to put them in a comfortable position, whatever is comfortable for them. So she wants her head lowered. I'm going to lower the bed. I'm going to make sure that she has her pen and paper within reach, her call bell, her table with her supplies. Again, before I leave, I'm just going to reassess that patient's tracheostomy. Since this is her airway, we just want to make sure that we've double checked that before we leave the room. So it's patent, she's not in any distress. So I'm going to clean up all my supplies, wash my hands, and then I'm going to document. Some things that I want to document is the pre-data that I collected, the breath sounds, O2 saturation, respiratory rate, that I performed trach care, if there's any secretions around the trach, what did they look like, their consistency, their stoma, what does it look like. Then I want to discuss if they had any O2, if I replaced that, if they had a trach collar. Then I want to document the post data that I collected, again, lung sounds, respiratory rate, O2 saturation, what I've left in their reach, their pen and paper, their call light, and that's the end of the skill.